Music therapy. How does that sound? We are going to start with the theory of music therapy and then move into the practice. What is music therapy? It is listening to or even interacting with organized, complex sound. Hormones and neurotransmitters are released into the bloodstream and into the brain. These include dopamine, endorphins, endocannabinoids, yes, that is the active ingredient of marijuana, and nitric oxide. These all contribute to vasodilation and decreased blood pressure. We will explore more of the effects of music therapy later on in this presentation. Interestingly, some studies show that the type of music matters. Techno music has been shown to increase norepinephrine, beta endorphin, ACTH, cortisol, and growth hormone. ACTH stimulates the release of aldosterone, remember, saving sodium and vasoconstricting. That would help increase the blood pressure. And cortisol, which is released in response to stress. Looking at techno music, it looks like it would be non-therapeutic in many cases. Another theory about how music therapy works physiologically is psychoanalysis. It is the thought that music triggers a positive memory and then aids in relaxing the individual. How does music therapy work physiologically? Let's look at it a little bit more. It can decrease pain by activating endorphins. Imagine this. You're playing baseball. You just hit. You run to first. You see the ball flying way out. You run to second. Someone's about to catch it. You run to third. And you think, I can make it home. And so you do. You run and slide in. It's exciting. You made a home run. The next day, though, you wake up and you find a bruise, along with a big sore spot on your side from where you slid in. But at the moment, you didn't notice it at all. This is because of the situation. It caused the release of endorphins, which act as the body's natural painkiller, like opioids. Music has a similar effect. Another study shown that music therapy stimulates the brain, which has been shown to increase the awakening of people who have had altered consciousness for 4 weeks or more. Along the lines of stimulating the brain, electroencephalograms have shown that the music therapy activates more areas of the brain than any other cerebral stimuli. These areas include the cerebellum, basal ganglia, supplementary motor areas, and prefrontal and premotor cortices. Basically, it regulates emotions, arousal, pleasure, and cognition. Who is benefited and who is not benefited by music therapy? This is what I found from the studies that I looked at. Premature infants and women in labor are not benefited, as indicated by the lavender. In the green boxes are patients who were benefited. These include children, older adults, patients experiencing depression, schizophrenia, dementia, and prolonged disorders of consciousness. Interestingly, the nurse-patient relationship improved with young people who were intubated. Also, 2 studies showed that social functioning is increased in patients with autism. Also, the agitation associated with sundowning in dementia is reduced if music is played during supper time. Okay, so how does this work practically? You can play recorded music, you can sing or have your patients sing. You can give them percussion instruments to play along with music. You can show a music video. One study included discussion of the music in their music therapy. Music therapy can range from 60 minutes 2 times a week up to 5 times a week, from 1 hour to 6 hours. The effects last, some studies show only during the time of therapy, and some studies show up to 3 months after the therapy. How do I know what kind of music to use? Studies have shown that music in a major key that is happy, positive, and harmonic is therapeutic. Music that is minor, negative, and dissonant is non-therapeutic. Why? Rah! Did you jump? That may have elicited an amygdala response. They also found that minor, negative, and dissonant music activates the amygdala, while other music does not. You may ask, what is the difference between major and minor? Let's listen to some examples. This first chord will be major, and then it changes to minor. Listen to the difference in the feeling. First is happy, and then it changes to sad. Minor. Alright, let's listen to a dissonant sound. Those sounds are dissonant. And this piece has a variety of chords. What was that, minor or major? Minor. Dissonant to major. So those are some examples. And sometimes it won't click with just hearing it. But if you listen to it more and more, it'll make more and more sense. Until then, look in the titles of the songs. Sometimes it'll be like Nocturne in C minor. Oh, well, that's minor. Keep in mind this is one study by Moore that reported that minor, negative, and dissonant music doesn't work. There may be more studies that come out that have different perspectives. What are some considerations with music therapy? Physical activity with the music is more effective in severe cases. This could include leading your patient in singing, clapping, marching, dancing, nodding their head, or swaying. On the other hand, passive listening is more effective in minor cases. This is taken from a psychiatric journal. Another journal found that patient-preferred music is more effective. Let's practice. So right now, we are passively listening. This is more effective in minor psychiatric cases. Now let's do some active music therapy. Nod your head. Clap. Alright, I'm going to give a quick review while we look at the references. Music stimulates multiple regions of the brain and causes the release of hormones which lead to desired or undesired effects depending upon the music. Music can be used in a variety of settings. Active musical interface may be more effective for severe cases, while just listening is effective for minor situations. Choose music that is major, happy, and positive according to the patient's preferences, if possible. Music therapy. How does that sound? To me, it sounds like a major part of harmonizing people. Please feel free to post any questions that you have.